If you've ever played sports or even just watched a game intensely, you know the sound. It's that one sound that just cuts through everything. A sudden, sharp, totally unmistakable pop from someone's knee. Well, today, we're going to break down one of the most common and, let's be honest, most feared injuries in all of sports, the ACL tear. And this right here, this is the classic first sign. For way too many athletes, this isn't just some textbook description. It's a real, visceral, and absolutely unforgettable moment they knew something had gone seriously wrong. It's the start of a long road, for sure, but really understanding what's happening, that's the first step to getting back on your feet. All right, so here's our game plan for this explainer. First up, we're going to demystify what the ACL even is and the signs you've heard it. Then we'll dive into the why, the causes, and the risk factors. After that, we'll look at the pretty serious long-term impact, and we're going to wrap up with the most important part, what you can actually do to protect your knees. So what exactly is an ACL injury? What are we really talking about when we use that term? Let's get right to the heart of this incredibly important piece of our anatomy. You know, the easiest way to think about the ACL is like a super strong rope, right, in the middle of your knee. Its main job is to connect your thigh bone to your shin bone, and it stops that shin bone from sliding too far forward. It's a key stabilizer. So when that rope gets stretched beyond its limit, or worse, just snaps, that's an ACL injury. It's really that simple. Okay, so you take a bad fall or make a sharp, sudden twist on the cord. How do you know if you've actually injured your ACL? Well, the signs are usually pretty immediate, and honestly, they're incredibly hard to miss. We already talked about that pop, but what comes next is just as telling. The pain is often intense, and the swelling can kick in almost instantly. But that last point on the list, that is the absolute classic sign. Athletes will tell you it feels like their knee just gave way or buckled when they tried to put weight on it. That's your knee's main stabilizer, basically screaming that it's off the jaw. Now, here's something that might surprise you. Most ACL tears don't happen because of a direct hit, like some brutal tackle in football. A lot of them are actually non-contact injuries. So let's take a look at why they happen and what might put you at a higher risk. This four-step sequence, this is the recipe for disaster. Just picture it. A basketball player plants their foot hard to cut to the basket, or a soccer player making a super sharp pivot to get around a defender. It's that combination, a planted foot and a sudden violent twist or stop, that puts an insane amount of stress on that ligament. So what sports are we talking about here? Well, as you can see, it's less about a single sport and more about a type of movement. Soccer, basketball, football, even downhill skiing, what do they all have in common? It's that dangerous mix of sudden stops, quick pivots, and awkward landings. That's what really puts the ACL to the test. Okay, now this is really fascinating because the risk factors break down into two totally different problems. On one hand, you've got poor conditioning. Your leg muscles just aren't strong enough to act like good shock absorbers for your knee. But on the other hand, you could be super strong, but if you have faulty movement patterns, like letting your knees collapse inward when you land, you're putting that ACL in a bad spot over and over again. And it doesn't stop there. Research has consistently shown that female athletes are at a higher risk, likely due to a mix of things like anatomy and hormones. But look at the rest of this list. These are things you can often control. The right footwear, making sure your equipment is in good shape, even the type of surface you're playing on. It all makes a difference. An ACL tear isn't just about missing a season or going through months of rehab. The consequences, well, they can last a lifetime. And this is why it's so important to understand the long-term impact. This is the really sobering part. Tearing your ACL dramatically raises your odds of getting painful arthritis in that same knee later in life. And this is the real kicker, that risk is still there, even if you have surgery to reconstruct the ligament. The initial injury just sets a process in motion that can cause problems for decades. All right, that was the heavy stuff, but the good news, the really good news, is that you are not powerless here. So let's completely switch gears and focus on the solution. We're going to break down the most effective, proactive things you can do to protect your knees for the long run. This is the million-dollar question, right? And the answer isn't to just stop playing the sports you love. It's about training smarter so your body is more resilient. The solution is all about being proactive with your strength and, just as critical, your technique. So, where do we start? Well, you might be surprised to hear this, but protecting your knees actually starts with your core. Seriously. A strong core, and by that I mean your hips, your pelvis, your lower abs, it gives you a stable base for every single movement. That stability is what helps prevent that dangerous inward collapse of the knee that causes so many of these injuries. Next up is balance. So many athletes are what we call quad dominant. That just means the muscles on the front of their thighs are way stronger than their hamstrings in the back. That kind of imbalance can actually pull the shin bone forward and put extra strain on the ACL. The goal here is to create a nice, even balance of strength all around the leg to better support and protect that joint. And finally, we have to talk about technique. Remember those faulty movement patterns? This is where you fix them. It means you have to actually practice landing softly from a jump, keeping your knees aligned over your feet, not letting them buckle inward. You can literally drill the proper form for pivoting and cutting until it becomes second nature. Okay, and we need to clear up a huge misconception. People think a knee brace will protect them. And while a brace can be helpful for support after an injury, the research is pretty clear. Wearing one doesn't seem to prevent that first injury from happening. It can give you a false sense of security. Your real protection comes from your training. So, if you take just one thing away from all of this, let it be this. Your best defense against an ACL injury is not something you can buy. It's something you have to build. By focusing on your core, balancing your leg muscles, and mastering proper technique, you can seriously lower your risk and keep yourself in the game. In the end, it really comes down to this question. It's so easy to get caught up in training just to win the next game. But real success, that's about longevity. Investing the time in prevention isn't just about avoiding an injury this season. It's about making sure you can stay active, healthy, and doing what you love for decades to come. So, which one are you training for?